I've been having a really bad cough. It just wouldn't go away. It had been going on for weeks. Mum had to take me to the GP. I also ended up in A&E a few times. I was really frightened. But the doctors there would just treat it like asthma. They gave me inhalers and other medications, but nothing seemed to work. I missed a lot of school, and Mum missed a lot of work, which caused a lot of stress. I was so out of breath all the time, which meant I couldn't do the fun things that I enjoyed. I was so miserable and frightened. Luckily, we live in an area where we're covered by a local child health team. My case was passed over to the LCHT by my GP. My GP asked lots of questions about my medical history. She examined my lungs very carefully. The LCHT model is really cool. But I don't quite understand why different kids in different areas don't have the same access to treatment like me. Mum, I need to go talk to the doctors about this. Hi Dr. Bhumika, what is the LCHT model and how does it help children like me?
The LCHT model stands for the Local Child Health Team model. It's a new and different way in how we provide healthcare to children. Normally, when you're unwell, you'll go to this GP surgery and see your GP, and usually they'll be able to help you by providing you with medicines and then you'll feel better. Sometimes children need a bit of extra care, so sometimes they come to us with more complicated medical health issues, which means that we have to send them on to the hospital to see a specialist.
How is the LCHT model different?
The Local Child Health Team model is different because instead of just referring you to the hospital to see a doctor, the GP is going to refer you to a group of people who's made up of a special children's doctor called a paediatrician, a community children's nurse, and a GP who will likely be from your own practice. They will go through your medical records, go through your results and come up with a plan.
What might that plan be?
So that plan might be that on looking at your records and results, they might decide to write back to your GP and advise on things that can be done or treatment that could be given. They may decide that you need some more investigations and you might need to have a few more tests done, or they might need a bit more information, or they may decide to see you in a clinic, which will be at your GP surgery, usually within a few weeks, and then the paediatrician, who's a special children's doctor, will be able to see you there with your GP. As a GP, the advantages of the LCHT model are the accessibility in building a strong relationship with our local paediatricians and our community nursing team. This also helps with responsiveness and in the speed of advice, essentially having a paed in my pocket and not waiting ages for letters and appointments from the hospital. There's also an educational aspect. We all gain understanding of the challenges each other faces, and we learn from each other in the process. I know the families in my patch do prefer to be seen locally. It's more personalised care and less disruptive to the child and parent, with care closer to home and school. As a GP, we don't always have sight of all the offerings locally, as these often change. Expert NHS care navigation saves both patient and clinicians time and money.
Hello, I am now here with Kate, who is going to tell us more about her role. Hi Kate.
Hi Esme. So I'm a specialist children's community nurse and my role is to help the team to make better decisions about care for the children that we look after.
I've been hearing a lot about the LCHT from Dr. Bhumika. What do you do in the team?
So I've got a great role in the team because I know lots about all the local community services that are available, and I can help to steer the team in the right direction so that we make the right decisions for our children, who some of them have lots of complex needs, or there's other children within the family that have very complex medical problems. And it's all about helping to make sure that that unwell child gets seen by the right people at the right time.
That sounds really cool. So you make kids better quicker?
It's a much better way of working when we all come together with all our different knowledge and experience, and then we can create that team around the child. As a community specialist nurse, I find that referrals are often directed to the hospital when they can be dealt with by our community colleagues, which avoids unnecessary delays. Patients prefer care closer to home, and this is particularly important for families where children have complex needs. As nurses, it's also often a challenge to get investigations requested and medications and treatments started. By using this joint approach, we can share our knowledge from community records such as health visiting, school nursing and therapies, as we often know the families in context of their other needs too. It's great to be able to get the right patient to the right place and seen by the right person the first time.
I am now joined by Dr. Shahid. Hi, Doc.
Hi, Esme.
What do you do in the LCHT?
I'm one of the paediatricians, so I'm a specialist children's doctor. I usually take care of sick kids in hospital, but I also run a clinic in hospital where I see kids who've been referred across from GPs. I'm conscious that there's a really long wait to see people like me, and that sometimes means that kids wait in the community while they're still unwell, missing school, and that causes a lot of disruption to the family. So it's really great that I can give input to that team and hopefully get them care, get them starting to feel better, or at least start them on the pathway towards getting investigations if they need them, treatment, whatever else needs doing sooner, so they're back to being well sooner.
That sounds great. Does it really work?
Most of the time, yeah. It's surprising how most of the cases we get referred from primary care we can manage in the community. There is a rare occasion when we have to bring kids into the hospital because they need specialist tests or specialist teams or specialist kit to help take care of them. But in almost all the cases, we can manage it in the community, closer to you, closer to home, closer to school, less disruption for everybody, and we get the same good outcomes. So it works quite well. We have fantastic individuals doing incredible work across the primary, community and hospital settings, but we often still, regrettably, just work in our own little silos. Our IT systems are a bugbear for us, as they don't talk to each other, and we still struggle with the aspiration of stealing shamelessly and sharing seamlessly, which can act as a real barrier in excellence in clinical care. Through this initiative, it's great to connect with a wider team, having buddies in the community, all working together towards better child health and well-being. It's a challenge in hospital to know the kids are waiting a really long time for advice, missing school, disrupting the lives of their families, and through the child health teams, we hope to narrow the window of ill health from the onset of illness through assessment, investigation, treatment, and then hopefully to return of health and well-being. Being part of a local child health team, I'm always learning from my patients, from my GP and nursing colleagues, and so much more about local community services, helping realize our shared goal of providing our children and young people with high quality, compassionate, and ever-improving care.
Every child, no matter where they live, deserves the same care. LCHT can make that happen. It's about equal rights to healthcare.
The LCHT model empowers clinicians by breaking down information silos and granting easy access to collective expertise. It's not just about convenience, it's about elevating the standard of care we can provide.
Grown-ups, please do what you can to help children get the care we need to get better quicker.